The phases of adjustable lap band surgery. There are several types of gastric bypass surgery, with one of the most popular being the adjustable lap band system. With this surgery, a fully adjustable band is placed around the upper portion of the stomach itself and is then inflated or deflated as the patient's weight changes. One of the major disadvantages of other types of weight loss surgery is the inability to adjust, which may slow or even stall weight loss altogether just as the patient starts to make good progress. There are other advantages to the lap band system, including the ability to adjust it if it is too tight and becomes painful. As with other surgeries, there are risks involved that should be monitored, and these will be explained to you before you go in for your surgery. For some patients, the lap band can be placed through a laparoscopic procedure which requires less recovery time and leaves a much smaller scar. However, this is not always possible, especially in the case of those who are morbidly obese, because the doctor will not be able to see as well and it becomes more dangerous. In this instance, the doctor will perform an open surgery, which will result in a slightly longer recovery time. This may also be the only option for those who have secondary health concerns, such as heart disease, diabetes and high blood pressure. For most patients, the phases of the lap band surgery begin after the actual procedure, while some may start preparing for their new lifestyle before they go under the knife to be sure that they will be able to handle the changes. Regardless of when you actually start, it is important that you be fully educated and aware of how things will be afterward, or you may be shocked and unable to adapt. While the lap band can be removed, it is a major and very expensive procedure and not one to be taken lightly. Know all of the facts before you go in. It is for this very reason that patient education and preparation is one of the most important steps in the process. Some rules to know before you start. Adjustable lap band surgery will completely change the way that you eat and drink for as long as it is in place. For most people, it is a permanent change. You should understand that if you do not follow the rules carefully and completely, you can put yourself at risk for malnutrition, especially if you are not eating healthy foods. You may also cause band erosion or band slippage, which will lead to the need for another surgery. For the first 3 months after your surgery, you will not be able to have any kind of caffeine, and you will never be able to have carbonated beverages again, since they cause gas and bloating and may be very painful. In addition to these rules, there are some guidelines for the foods that you should eat and the ones that you may have problems digesting. Tough meats, especially those that have gristle or excessive amounts of fat, may not be digested very well and can cause you to have some very severe problems. Hamburger, steaks and pork chops are examples of meats that may not be well tolerated following the adjustable lap band surgery. Oranges and grapefruits may be a problem as well unless the tough, white membrane is removed. You may never be able to tolerate the seeds or skin of any fruits and vegetables, meaning that you will have to carefully peel and de-seed any of these that you eat. High-fiber vegetables may be difficult to eat as well. Some patients may have problems with spicy or fried foods, and other spices may cause problems too. These spices include black pepper, cinnamon, onion salt and garlic salt. Finally, some patients may have problems digesting milk and some milk products after their surgery. Special considerations for medications. After your lap band surgery, you will have to be careful about the medications that you take and how you do it. Of course, you will have to continue to take meds for conditions that you are already being treated for, but there are some limits that you will have to follow. Any new medications that you might have to take will be carefully considered by your doctor following surgery. Any pill that is larger than an aspirin may have to be cut in half, but there are some precautions regarding this practice. Enteric coated pills, meaning pills that are coated so that they are not digested too rapidly by the body, cannot be cut or crushed because of their protective coating. Irregularly shaped pills and capsules are also not advised. There are other options for certain types of medications, including topical creams, liquids and injectables, so the doctor can help work out the best plan for you. Phase 1 after lap band surgery. The first phase after lap band surgery will last at least 3 to 4 days, but may last as long as a few weeks depending on the speed of your recovery, your beginning weight and your goal weight. During this phase, you will only be allowed clear liquids, keeping in mind that you are not allowed any caffeine for 3 months and no carbonated beverages at all. Clear liquids include broths, jello, some juices and fruit pops. Your doctor will give you an exact listing of what you can and cannot have and how much is allowed. This phase gives your body time to heal following the trauma of surgery and to adjust to the new, smaller stomach. Phase 2 after lap band surgery. The second phase will last longer, again depending on current weight and weight loss goals, and can be expected to be around 5 to 6 weeks of a modified, fully liquid diet. During this phase, it is important to follow your doctor's directions exactly because you will be at risk for deficiencies if you do not. The most important factor will be consuming 2 ounces of a protein shake every hour for the 10 to 12 hours that you are awake during the day. You will also consume 2 ounces of other liquids, such as soup, baby food and sugar-free gelatins 3 times a day during this phase. Phase 3 after lap band surgery. In the third phase, which may be considered the final phase, the use of shredded foods will be started. These foods should be as healthy as possible and will include some meats and other protein sources, vegetables and fruits and salads that are processed into very small bits. It is important that you take small bites, chew thoroughly and pay careful attention to your body. You will not be adding breads, starchy vegetables or potatoes back to your diet at all, and your body will never be able to handle more than 4 to 6 ounces at a time. During all of the phases, it is important that you get enough protein. Too little protein will lead to hair loss, fatigue, muscle weakness, delayed wound healing, depression, anxiety, irritability, apathy and other health problems. Protein deprivation can also lead to a very serious condition, which if allowed to continue can lead to death. A protein supplement is necessary during all phases after this surgery, such as ProfectR, a liquid protein from Protica, which can be very beneficial to the post-op patient. It is small, less than 3 fluid ounces, and low in calories, 100 per serving, but high in digestible protein, 25 grams per serving.